you're monitoring the physiological systems of heartbeat, blood pressure and temperature,
brainwaves,
whatever else, the physiological factors. If, I don't know if it's even a possibility, but if you find a way to monitor the neurological system, ignoring the physiological system completely, see, the concern may be the moment you put somebody on the table and start opening the body, the concern of a doctor or a surgeon may be that you don't want him dead on the table. So you're watching his heartbeat, you're watching his pulse and you're watching his all the other parameters. I understand and appreciate that concern. If we monitor the neurological system, not just the brain, the neurological system in the body, if we have a way of monitoring that, I think the entire art of anesthesia could raise to a different level at a very minimum interference. It could happen because why I'm saying this is, there is something called as marma in yoga and also in what is called as Kalari in South India. It's a certain form of martial art. Marma is a way of killing the pain completely at certain moments when we want to, just by touching certain parts of the body, handling body in a certain way. So essentially what we're doing is, the neurological system, we're shutting it off and there is no pain at all. We can go ahead and do what we have to do and only when we release it, the pain will come back. So, using that as a basis, I'm saying, if medical science has a way of monitoring the neurological impulse as it's happening, and if there is some way to introduce anesthetics in whatever form that you use, I don't know all the cocktails that are used, but if it is done properly, probably with 2% or 3% of your medicine, you could still have the same effect on the patient. Because how you use any medicine on the body and how you use it on the neurological system, I would say 1% of what you use on the muscle, if you use it on the nerve, it will produce equal effect.
The practice of Kalari Chikitsa is very popular in the northern parts of Kerala. The practice of healing are based on sound principles of Ayurveda and has therefore been found to be very effective, especially in the treatment of simple fracture, joint dislocation and similar injuries. People in northern Kerala still prefer to go to a Kalari master to treat such injuries rather than go to a hospital. There is also empirical evidence to suggest that expensive and complex surgeries can be avoided in the treatment of ailments relating to the lumbar region and spondylosis. Kalari Chikitsa also has been found to be very effective in post-operative orthopedic rehabilitation and in restoring health in patients who have suffered strokes. Kalari Chikitsa is very relevant in the context of sports injuries and it is evolving as an alternative to conventional physiotherapy. Indian sports medicine is a promising area for aspiring Kalari students who want to study the field of medicine and sports. The knowledge of Kalari Payattu and medicine put this treatment form on a unique plane with scope to deal with psychological and physical aspect of treatment, especially in the area of rehabilitation and restoration of sportsperson to normal active life. Kalari Payattu is the oldest form of Oriental martial art, encapsulating Kerala's unique culture, mytho-historical heritage. Here the term Kalari Payattu is derived from the combination of two words as Kalari, which means the training place, and Payattu means the training. Kalari is considered as the arena where the traditional physical discipline which cultivate mental, physical and spiritual benefits. The Kalari legacy is also considered as a scientific system of physical culture training beneficial to the modern sportsman and physical culturist. The arena of practicing this spiritual art is called as Kalari, which literally means a place where the knowledge is being taught. The Kalari arena possesses a spiritual height of a temple where there is many sacred rituals are carried out in a daily basis. So the Kalari arena is a center for training, healing, and also served as a temple.